So with the finasteride or the Propecia treatment, a lot of guys will read on the label that it causes an issue with impotence or erectile dysfunction. Now, most of these studies were done in older men. Most of these studies were done back when they were doing the prostate medications. So these older gentlemen certainly had trouble with getting erections, had trouble with impotence. So they would check on the little questionnaire sheet. Yeah, yes, I have trouble with erections. Yes, I have trouble with the impotence. So that's how the labels typically get on these products. Never had any issue with younger men having any issues at all with the finasteride or the Propecia products. Now, what if we already lost our hair, and how do we get that hair back? Well, that's how we need to then replace what's gone. So the older style hair transplant were done with the strip method, where a strip of hair was taken out across the back of the scalp and cut up individual hairs and then put back in. It was nice. It looked very nice in the front because there was individual hairs there. The problem was there was a big scar across the back of the hair. So if you cut your hair really short, or you decide you're tired of having hair and you shave your head later in life, there's a big scar on the back of the head, which obviously we don't want. So now we use the neograph machine to do single follicular unit extractions called FUE or SFUE. So we're taking out single follicles at a time, removing those hairs and putting them back in. So now there's no scar on the back of the head because we're removing individual hairs and replacing those hairs back on the front, back in the frontal hairline, back on the top of the head to get a nice natural hair pattern. We can recreate the nice frontal hairline, the swirls and patterns that we see in the top of the head as well. That's done with a neograph machine called a single follicular unit extraction. We're taking out one hair at a time, putting one hair at a time back in.